Thank you, Mayor, and I know this is right in the middle of a work week, right in the middle of a work day, so thank you for taking time to be out here as a community to look at what more we can do to address the COVID cases, but also to increase the vaccination rate. And I looked at everything that we've done as a state, and I said, you know, you don't need any more mandates, you don't need any more stuff from Washington or from Little Rock. Everything is out right now, and what we need perhaps are some good community conversations as to how we can better make sure that the vaccine is available and that we address hesitancy issues and acknowledge that they're real and they're there. And so that's what I hope we learn today. You all have been handed, and you don't have to fill it out, but it's an opportunity. Maybe you don't get to say something today and you want to express yourself. Fill that out. That will be helpful to us. There's some very simple questions there. Maybe you can give us some ideas, and you can drop that off before you leave today. So let me start off by making sure Senator Dave Wallace, Representative Monty Hodges, and Representative Johnny Rye. I know Johnny is here, but thank you for being here. And then Judge John Allen Nelson, thank you for, there you are right in front of me. You're always there to keep an eye on me, aren't you? And Mayor, thank you for your hospitality today. I did want to introduce Dr. Jose Romero, who is from our Secretary of our Department of Health, and he will help me to answer some technical questions as we go through this. But let me first start by setting the stage. Over the past month, we have seen a significant increase in the number of daily COVID cases, active cases, and hospitalizations. Now, let me paint the picture for you. On June 7th, that was a little over a month ago, on June 7th, we had right at 1,594 active cases. A month later, we had 6,600. And that was July 9th, and so now we have 7,255 as of yesterday. On new cases per day, on June 7th, we had only 62 new cases statewide in Arkansas. 1 month later, on July 9th, we had 1,155 cases in one day across Arkansas. Hospitalizations. On June 7th, we had 175 Arkansans hospitalized with COVID. One short month later, on July 9, we had 497 hospitalized, and now we're 3 days later, and it's up to 565 over the weekend. And so let's look then at Mississippi County and Blytheville on our vaccination rates. And I think we have a slide on this if it comes up. But this is important for us to talk about today and to recognize. So you've got on the left Blytheville, first of all. In the city of Blytheville, on the left is the darker color that is fully immunized. So 47.6% of the residents of Blytheville are fully vaccinated. Now let's give Blytheville a round of applause there, Mayor. That's not where we need to be. We need to be higher, but contrast that to Mississippi County. All of the rest of the area, that's 28.4% fully vaccinated. Now the lighter color are those that are partially vaccinated, and you can see the difference there. But just look at the fully vaccinated, the difference between the county and the city of Blytheville. And you can see this all across the state of Arkansas, city, county, city, county. You will see that, and they might actually have another one up there. You can compare. You have any other area? That's all right. You know, but at Forest City, I'll be going to the same discrepancy between the city and the county, and so the lesson from that is we have a challenge in the rural areas of our state. The cities, we've got to continue to push it. but we do better in our cities versus our counties. But guess where those in our county, in Mississippi County, shop, or where they buy groceries, or where they go to school. And so we're interacting with them from church to all the other activities. We need to get everybody vaccinated throughout the area. Now, there's a reason for this increase. There's two reasons for the dramatic change over the last month. First of all, we have here in Arkansas now the Delta variant. And in fact, nationwide, over 50% of the new cases are the Delta variant. Now, what's unique about the Delta variant is that it is more easily transmissible. In other words, you're going to get it easier. And then secondly, there's twice as much risk of going to the hospital with the Delta variant than the original strain of the virus. And so the Delta variant is a new twist that has come in. It started, I think, in Missouri. Well, actually, it started in India, but it hit Missouri, and then it came down to Baxter County, and it's come across the state. The second reason that we're having more cases, and with the Delta variant out there, the second challenge is low vaccination rates here in Arkansas. And so if you look at our vaccination rate compared to the nation, statewide we have 35% of Arkansans that are fully vaccinated. 35%. The national average for fully vaccinated is 48%. So we're at 35, the nation is at 48 on the average. And it's too low of a vaccination rate for Arkansas, and of course Mississippi County is even lower than that. And so the risk of the Delta variant continuing throughout and creating more cases and more hospitalizations is much more significant when you have that low vaccination rate. Now, I always like to look at the states that are doing it different or having a higher rate. Vermont, 66%. Massachusetts, 62%. Maine, 62%. Connecticut, 62%. Rhode Island, 60%. And then if you come down to the south, the lower five, the lowest states, the states with the lowest percentage fully vaccinated, Alabama, Mississippi, Arkansas, Louisiana, and somehow Wyoming got in there. Now, what's in comparison there, or the same, is that they're all rural states, and many of those states that are in the south have the Delta right there. And so we have some things to overcome. We've got to probably more skepticism in those states about the vaccine that we've got to win over and show that this is something that needs to be done. So now, before I turn it over for questions, let me talk about the urgency of the moment. The urgency of the moment right now. First of all, school is starting 1 month from now. Now, that means it's right around the corner. How many educators do we have here? Well, we got educators here. I'd like to hear from you a little bit. But we had a good school year last year with many challenges, but we got through it. And we're going to have a good school year coming up. But as an ingredient to having a good school year, we have to increase the vaccination rate. Because with the Delta variant out there, if our teachers are not vaccinated, our staff's not vaccinated, if the students don't have a higher rate of vaccination, then we've got challenges. And that's the reality of what we're looking at school. That's the urgency of the moment. The Delta variant is gaining ground, and the solution is an urgent moment because the solution is available. People are always asking me, well, how do you protect yourself? Get the vaccination. Get the vaccination. In fact, today we have all 3 vaccines that are available right here. And so before you leave, if you haven't got a vaccination, you can get it. What direction is it, Doctor? To the right outside, all right? All right, so we've got our local health unit that has the vaccines here. I hope that you'll take advantage of it because the solution is here. We see hospitalization cases going up, and I worry about new variants that could develop. Right now we're dealing with a Delta variant, but the longer this hangs around, the potential for another variant to occur. Let's don't let that happen. Let's go ahead and get the vaccinations done now and be safe and get done with this. The key to success is not what the government is doing. The key to success is individual action and community action. And that's why we're having these COVID conversations here in this community. And so with that, I want to turn it open. We've got a microphone that we'll pass around, and don't be bashful about this. Nobody's judging you. And I do ask you that we all be respectful of our time, first of all, so that everybody can have an opportunity to say something, but also just respectful in tone. We can disagree, but we need to hear it. We need to figure out solutions. So with that, let me turn it open to questions or comments that you might have. All right, Johnny? What'd you say? We get a microphone here.
First of all, Governor, we appreciate you being here today, knowing the seriousness of the situation that we're in. Governor, by looking just at these charts alone, this is affecting Judge John in my area big time. Looks like the city of Blytheville is locking down pretty good. But we really need to think about what's going on. And you say, well, we don't trust the government. Well, you know, that's okay, I guess. You know, but I don't think that we really need to look at this situation in this way, Governor. You need to ask, and we need to ask our friends, look, do I care about you? Do I care about you? If I care about my friends, I'll get this shot. So actually, we need to think of other people than ourselves. And if we will do that, then I believe that we'll be on the right course. But we do need to take this very, very, very seriously and do the things that we can do personally. That's all I need to say, Governor.
Thank you, Johnny. And, of course, what we're trying to figure out, you know, things that you can comment on, you know, what can we do better? How can we overcome hesitancy? What are the reasons that your neighbors and friends might not be getting the vaccine? And is there things that we can do different? The employers are here. You know, how are you doing in your workplace? Yes, sir. Izzy, as you're coming up there, would you introduce yourself since this is your home?
Hi, I'm Izzy Bond. I'm from Jonesboro, but I spent a lot of time in Blytheville as Miss Lights of the Delta 2 years ago, so I'm very excited to be back with the governor's staff today.
Thank you, Izzy.
Thank you.
She wanted to be here particularly. All right, sir.
My name's Lowell Walters. I'm the director of the county library system here in Mississippi County, but my question comes from more of my personal interactions with people out and about. As you ask, you know, what can we do better about some of the hesitancies? I know that you have a background from Bob Jones University, right? So you can appreciate the fact that some people have an eschatological view as to why there are people out there that think this is leading to things such as the mark of the beast and things like that. And there's computer chips embedded in these vaccines and things. So I know that you can appreciate where some of these people are coming from and their fears and things. But I wonder if we could have more religious leaders of national significance get together and say, this is not what this really is. And I think a lot of people are hesitant because of their eschatological views, whether people agree with them or not. They're thinking this is a last days thing and the government's shoving this down your throat and they're going to track you. And do you know what I'm getting at, and what would be your response to that? I fully appreciate the eschatological views. I hold to a lot of them myself, but I'm fully vaccinated, and you know, it's just different. I want to hear your thoughts on that from your worldview as our governor there.
Well, thank you. You sort of laid out a lot there. You know, first of all, there's I pulled up, you know, on well, you look on the internet, but it's also an organized effort that talks about mind control, It talks about you know, the design that somehow the vaccine is going to allow people with 5G to know that something about you and mind control. Anyway, all you can do is answer it with science and facts. And this is not about the second coming. This is about the health that we have now. And, you know, I'm a believer. I trust in God. You know, I know the end of eternity, but we have a responsibility to care for this temple and to listen to people and to make sense and not to follow myths. And so I think you have a very good point that pastors are a trusted source. And we need to really work with our churches, and they have, you know, they've had vaccination clinics, but you have some that are saying just the opposite from the pulpit, and shame on them, because you could be leading to death. You could be causing somebody in your church to die if you tell them don't get a vaccine. And so truth is always the answer to cynicism and distrust. Truth is what builds. And so that's what we've got to convey today. But thank you for raising that. All right. This is good. Yes, ma'am.
Hello. I am Councilwoman / Evangelist Vera James for the city of Blytheville. I was looking over the paper that was handed out. How do you persuade? I'm fully vaccinated. How do you persuade people? And one of the things that I've been sharing with some people that's got this negative thing about the vaccination is, I'm 73 years old, and I remember from a child up, we had to get vaccinated. We had to get the polio vaccinated and the tetanus shot, and we did that. And wasn't questions asked about it. It was just something that at the beginning of the school year we had to make sure that we were, our children were. And I tell people, you didn't know what was in that, and you had faith to get that done, then you should have enough faith to get this done, because we're hearing about more sickness, hospitalization, and death than we did with the polio vaccine and the other vaccinations that we took down through the years. And so that's one of the ways that I would encourage people, you know, and talking about the mark of the beast and all of that stuff. Yeah, that's coming. We know we're coming to the end of time. But I would say that we spend time trying to encourage one another the importance of this. Even if you don't feel like you should, if you love somebody, if you love your mama, your dad, or sister, or brother, then do it for their sake, because I'm sure there's people, even in this room today, got multiple health problems, as I do myself. And so this is one of the things that I use, and I encourage you, if you have not tried that technique, is remind people that for years we've been taking vaccinations. For years, down through the years, we've been vaccinated for one thing or another. So that faith that you had to get the vaccination from even when parents was making us get it, even till now, then you should be able to take this vaccination that will help us in the future.
Thank you. That's a good reminder of history that we've always had vaccinations. Right over here is a question or a comment.
Hi, my name's Cody. The first question was, you know, why do you think people are skeptical? And a lot of those reasons seem to be political. It seems like the majority of people in rural areas are white Republican men who don't want to get that vaccine. So how are the Republicans who represent this state promoting that so that hopefully those people who look up in this area to Tom Cotton, Senator Boozman, those people, how are they promoting the vaccine?
A great point. And you know, some of the national media, you know, rightfully, I mean, they criticize President Trump. Maybe he didn't do enough. Maybe he was inconsistent for a while. But the fact is, President Trump today says, get a vaccine. And I've heard the ads with President Trump's voice urging everybody to get a vaccine. And so this is not a Republican-Democrat issue, because you look here in Arkansas, it's a by and large, it's a Republican state. It's a red state. I've been vaccinated. Our leadership has been vaccinated. And Representative Rye just testified that he's been vaccinated. And so I do think that in the rural southern states, which is more red, there is some hesitancy about government, and I think that is a factor. It's a sort of a conservative approach, but it shouldn't be partisan, and we've got to move beyond that. And so the answer is we're using every trusted advisor we can, and obviously our political leaders have a voice, but it's our medical community, it's our pastors, it's our community leaders, it's our communities. What do you do, ma'am?
I'm the parks director for the city.
There you are. You're a leader. All right. Hey, thanks for pointing that out. And we've all have to pitch into more, but, it's really, you can die as a Republican, you can die as a Democrat from COVID, and both need the vaccination. And then we had a comment here.
Hello, sir. My name's Marcus McClain. I'm with the newspaper here in town, the NEA Town Courier. My question was along the lines of, with our vaccination rates as the way they've been going and the Delta variant, as you hinted at, is there a situation where there could be more variants to make our current vaccines almost ineffective?
I'm going to answer that. Obviously, I'm going to have Dr. Romero to answer that as well. But just like when we started out with COVID, we didn't have the Delta variant, and it was developed. India, UK had a variant. And so, yes, that's the motivation for getting the vaccines, because, Dr. Romero, am I correct that the longer this virus exists, the greater potential for another variant to develop? Right now, the vaccines cover all the variants, and so it's effective against them. But we don't know how it would mutate in the future. But Dr. Romero, you can do better than me on that.
Not much, Governor. Not much better. There is the possibility, but right now, remember, the problem today is that we don't have enough persons immunized to prevent the spread. And every time it spreads, it has a chance to mutate. So we are, at this time, capable of tackling the viruses and the variants that exist. But it's up to us to take the vaccine. There is the theoretical possibility, way in the future, that could happen. But we can stop it from doing that here in our country by having the majority of us take the vaccine.
Could I hear from some of our medical community? I'd love, could you introduce yourself first, doctor? Or I see white coats out there, so I'm making an assumption. We'll come back.
No, not me.
All right. No taker there?
No? Okay. Hello, my name is Shamir Ashley. I'm a family physician with Mississippi County Hospital Systems here in the area, and I am fully vaccinated. My family, my two children and I did contract COVID-19 back in October, and then we decided to get vaccinated. I think it was like 3 or 4 months after that. And so we did very well. No one was hospitalized. No one got severely ill, thank God. But we were exposed through other family members, not through work, which was awesome. So we wasn't able to expose other patients during that time. But I do advocate being vaccinated. I do go out to the community and talk to different teenagers that's at the age group, as well as adults, about being vaccinated as well. Yes, sir.
Could I ask you a question? Do you have the vaccines in your clinic if somebody came in and they wanted a shot?
So we currently have the vaccinations through the hospital, so if they do want the vaccination, we do gather those patients up and then we call them in to come in and get the vaccine.
Great, great. Thank you.
Yes, sir.
And then I cut somebody off right here in the middle, is that right?
I'm Cecil McDonald, Justice of the Peace for Blytheville, Mississippi County. My question is this: based upon the statistics that we possibly see on it, and this is an estimated guess, when school starts in a month and there's a surge, what resources will we have to take care of the surge? I'm speaking for some of the, my family has a funeral home, so we will go and deal with people who have COVID. I also work at a Head Start, so I'm on the front line with little children, and believe me, what are resources that will be available more than we had, because through this last stretch, we sent people to St. Louis, to Little Rock, to Nashville, to the hospital. We need better resources for Mississippi County to deal with these illnesses after, because COVID exposed the disparities that happen in the rural community. Governor, we need better resources for the people of Mississippi County, beyond the COVID. Thanks.
You said beyond COVID?
Yes, sir, beyond COVID. We're going to need them. And I know you know that, but what can be done here to help us so we can live better qualities of lives, because this pandemic has exposed us in a whole lot of ways. What can better happen for Mississippi County? How can we be better served to serve the people here?
Well, great question, and we do have a disparity in health care between our urban centers and our rural areas. And so it's a little bit of a side issue, but one of the things that we're doing in the state is developing a bigger partnership with our smaller hospitals in our rural communities to make sure they're stronger and they can provide drug addiction and counseling. They can do more in maternal health, mental health counseling as well. And so we do have some things that are trying to improve that. But let's focus on COVID, though. And right now, our hospitals are packed. And our hospitals are packed not simply because of COVID, they're packed because of other health care needs that have been built up. And so when you see a crowded hospital, it's because of a few COVID patients, but it's also because of all the other health needs. Now, as we look forward to school, there is one critical resource to make sure that we have a good school year and that we don't have a surge in cases, and what is that? Everybody get vaccinated. If a teacher is worried about their health in the school, get a vaccination. If students are worried, if you're over 12, you get a vaccination. And the more we get vaccinated, then the less we're going to have in cases in our community and in the hospitals. For the athletes, and this is important because it's a motivator. And I've got a grandson that plays basketball. He's a senior at Bentonville, and he was one of them that jumped in there to get a vaccine because he did not want to miss games and to be quarantined because of exposure to somebody else. And under our health department rules and CDC guidance, that if you have the vaccine, if you've been vaccinated and you've been exposed, you don't have to quarantine. And let me tell you, that ought to motivate athletes and cheerleaders and everybody who's engaged in extracurricular activities. And so that is a motivation for it. Yes, sir.
Given the motivation that you just talked about, are we doing enough to make certain that the people who might be motivated by that know that they would not have to be quarantined? And also, given the numbers for the state of Arkansas, the low numbers for vaccinations and the rise in hospitalization, is there a chance that the vaccine could become a mandate?
All right. The question on whether the vaccine could become a mandate, it will not happen as long as it's until we get FDA approval. And once the FDA approves it, then private citizens or private businesses can mandate it for their employees. And the state, because the legislature passed a law that said there's not going to be any state mandates or passports or vaccinations for COVID vaccinations, currently we cannot do that. And so the state's not going to be mandated in the schools I'd have to call a special session in order to change that law. I don't know whether they will have that support or not. And so right now, it's not about a government mandate. There's not anything like that in the near future. It's all about individual decisions, making good judgments. Now, the first part, you made a comment, are we getting the word out that if you're vaccinated, you don't have to quarantine? The answer is no. We need to get more of that word out because that's an incentive. And that's why, I'm not pushing people, and I love the variety here. People make a decision to protect yourself, to wear a mask if you're not, and so that prerogative is there. Individuals make decisions for their own health. So I thank you for raising that. Good stuff we're getting here.
Right here.
All right, we have back here. All right.
Hi, Governor. My name is Samantha Wells. I work for NEA Town Courier. Can you hear me? Yes. My name is Samantha. I work for NEA Town Courier here in Blytheville. And so my question is, I want to round back to the promoting of the vaccination, and I am fully vaccinated. I've been vaccinated since March. I did get the virus in January, and it was tough, but I did not have any of the respiratory problems. I had all the other symptoms. So for the people who have been vaccinated and have contracted the virus even after being vaccinated, my mom being one and my dad being another, how do you promote the vaccination when there are things like that going on?
When somebody who
has already been vaccinated and they've contracted the virus after being vaccinated.
All right, and I'm going to ask Dr. Romero to answer that question, but let me say that, did your parents have both shots?
They did, and actually my father right now he has been on life support for a month.
Okay.
From the virus. So when there's situations like that, they're very scary. He's been vaccinated and now he's very, very ill. And so how do you promote the vaccination? And I am fully for the vaccination because I'm vaccinated.
Well, my answer to that is that whenever they talk about the vaccine having 80% effectiveness or 90% effectiveness, that means that if you get the vaccine, 90% of the time that person or the individuals are not going to get COVID, but there's 1 out of 10 chance that you would get COVID. Now, by the fact that you've had the vaccine reduces the potential for hospitalization and serious consequences as well. Dr. Romero.
As the governor said, that's correct. And by the way, my sympathies and my best wishes for your father. So we know that there will be a certain number of individuals that receive the vaccine that will become infected, but those individuals will not have severe complications. I don't know how old your father is and whether there are other comorbid conditions, other conditions. So all of those go into the actual effect of the vaccine. There will be people that don't get full vaccination. As the governor said, it's a percentage, right? But the vaccines are extremely, extremely effective. When we started out trying to develop a vaccine, we were looking for vaccines that were 50% effective. Our vaccines today are 95% effective. They work. So, unfortunately, nothing is 100%. I'm very sorry, but you need to protect yourselves. You need to take every possibility available to you to prevent severe disease.
Okay, I have somebody over here. Yes. Oh, I'm sorry. We'll do it over here, and then we'll come back. She's standing there. Yes, ma'am.
Governor, I'm Felicia Pearson. I'm the Chief Nursing Officer for Mississippi County Hospital System. I want to thank a lot of my team members are here today. Thank you for all the resources that we got during the whole COVID year that we've had. One of the things that we get a lot from people in the community are those individuals who have already been exposed to the COVID virus, and they don't want to take the vaccine because of that. So I thought maybe that Dr. Romero could speak to that. You know, I think that's a lack of education on a lot of our parts, not understanding why should we get the vaccine when I've been exposed to COVID already and I have the natural immunity.
Thank you very much for that question. So why should you get the vaccine if you've already been infected? because we know that natural immunity is not strong enough to prevent, in particular for the Delta virus, their variant. Getting a vaccine boosts your antibody levels hundreds of times higher. And so it lasts longer, we think. And because of that, natural immunity, that is what everybody says when you get infected, is not enough to protect you. You need to get that vaccine in order to make yourself fully immune to that virus in the long run.
Still has antibodies a year later. I know that it's different for each person, but I really do believe that is a big struggle here in Mississippi County for us, and just from talking to people within our community is just trying to understand that, like knowing that you got exposed. How did you know you weren't exposed to the variant in the first place? You know, I know the virus is new. There's a lot of questions out there, but those are things that I hear throughout the community, and you know, I would like to have resources to take back, you know, and say, well, this is why, you know, why you have it.
So to answer part of that question, and then we'll go forward. The question about how do I know I'm not protected against the Delta variant at this time, the variant didn't really appear to enter into our state until about 6 weeks ago. So anybody that's been infected a year ago would definitely not have anything with the variant. The other thing is that antibody tests that are out there, okay, they do not measure protective antibodies. They simply measure the development of antibodies. And so there are protective antibodies and antibodies that just indicate that you've been infected. We don't have a test that is commercially available that will tell you you have the right antibodies to protect you. So having the antibodies doesn't necessarily mean you're protected by natural infection. We know that the vaccines cause your body to make the antibodies that are protective, and that's why we want you to get that vaccine.
Over here.
She had the same question.
Okay, we got that covered then.
We've got another one over here.
All right, good.
Hi, Michelle Sims with the school board here in Blytheville. My question is similar to Mr. Lester's, but regarding maybe the mask mandate, maybe not being the vaccination mandate, but the mask mandate probably coming back, or a possible shutdown again. If it's spreading so fast as the numbers are stating, do you foresee that? As we've seen when it was lifted, everybody's out, majority without masks, they're gathering together, family reunions, traveling, so that's going to add to the spread. So do you foresee anything in the future, especially with the schools starting?
Thank you. And if you're not vaccinated, the mask is very important to protect others. And so we continue to encourage following those CDC guidelines of wearing a mask if you have not been vaccinated. Now, in terms of a mandate where the public has to wear a mask, no, we're not going to issue that mandate. I'm prohibited by doing that by law now, and I don't see that changing in the near future. Obviously, nobody can predict what situation we're going to be in 6 months or a year from now, so anything can change. But no, right now it is, everybody knows what to do. Get vaccinated, and if you're not vaccinated, wear a mask. And so if you did a mandate, it would be totally unenforceable, because you'd either be making people who've already been vaccinated wear a mask, which discourages vaccinations, and it would be totally impossible to really police that. So we have to count on everyone here doing the right thing for yourself and others. Thank you.
I'm Lauren Starks, and I work for Blytheville School District. Being an educator, we know that accessibility is an issue for our students because the majority of them do depend on public transportation. So you asked what type of support that we can provide. What have been the initiatives to take like mobile clinics into these communities where accessibility is a problem for transportation?
That's a question that we need to spend more time on. I agree totally, and we need to, I don't know exactly right now. I know we have pharmacists here. so you can go to your pharmacy and you can get a shot. We have hospitals that are represented here. You go to the hospital and you can get a vaccine. You can go to your local health unit, and the local health unit can make sure that vaccines are covered. And then we have a toll-free number that you can call, and we will make sure that if somebody needs delivery, if they need some home access, we'll work on getting that done. Tremero, do you have another point on that?
We do have mobile units that are at your disposal. If you have a community where this is a major issue, where you do not have a local pharmacy, you do not have access to one of our federal partners, you do not have access to the local health unit or to a hospital, we can provide direct a mobile unit to your community for vaccination. You only have to call me. I will make sure that it gets there.
Good. And so follow up with us. We'll send a mobile unit. We have those available. But also here, Judge, help me out here. What are we doing in this county to improve access for the vaccines out in the more rural areas?
We have two health departments here in Mississippi County, one in the south end of Ola and one in the north end at Blytheville, that give the vaccinations. And all of the drugstores from the locally owned from Walmart all the way through give vaccinations. If there's a problem with someone getting a vaccination, they can call the judge's office and we'll provide that to them if we have to take it to them or whatever that we can get done.
Thank you, Judge. And that's really important. If there's a community that's underserved and they want the vaccines, you make the call, we'll get it to them. We'll put it on us. We'll make sure the vaccines are there. If there's somebody that doesn't have transportation, we will make sure that happens. We have some of our contractors, hopefully, that are working in the community as well. All right, let's go. That's really a good observation. Thank you, Judge. Over here to the left. Yes, you. Yes, sir.
Yes, I have a question. My name is Pastor Carl Rogers in Blytheville here, and I'm very concerned citizen, especially for all of it, the spiritual aspect as much as the physical. And my question is that, do we have incentives as far as funds that can be given to churches that can help promote vaccines, people getting vaccinated? Because the leaders, where we meet with many people every Sunday, Wednesday, and if I'm understanding, there's a lot of young people that is refusing the shots, and for various reasons. They feel like they're going to be, that it's going to kill them, or different things like that. And I've even been to the doctor where some nurses won't even, they won't take the shots. So is there anything that is out there to where there's incentives
I got you.
that help that?
All right, I'm glad you mentioned that. Incentives, first of all, we tried incentives in Arkansas in terms of scratch-off lottery tickets, in terms of game and fish hunting license or fishing license. There was some challenges there. We didn't see that as being very effective. We did give, as a state, incentives to our employees to be vaccinated. It was a $200 bonus that netted out to $100, and I think there was some effectiveness there. I've encouraged our institutions of higher education to have an incentive program for the students. You get vaccinated, we'll give you, a week's free groceries from the commissary or from the, something from the gift shop. And then you can apply to the state to be reimbursed. You got to get all those rules set up in advance. But I'm open to any incentive program that works. One of the challenges is that if you want to give everybody $100 to get a vaccine, then you're going to have about 50% of the public saying, where's my $100 because I got a vaccine and did the right thing 2 months ago. And so there's a fairness issue as well. And so the churches are probably a little bit more difficult because just administering with that, but we're continuing to look at whether there's any incentives that work, and businesses are a good opportunity there. Can Prime Metals share any light on how you're encouraging vaccines in the workplace? I caught you off guard there, didn't I?
Well, you know, it's a tough sell to some. I mean, some people believe that, you know, the government, the county, making us do this. Well, we have to erase that perception. I've read a study, one from the state of Connecticut, one from the state of New Jersey. And of these new cases, which there's no question there's an uptick in cases. I mean, I follow it every day and have since March the 10th of last year. So what I try to do with our workforce is just educate them. The data should tell you what you need to do. But the state of Connecticut and the state of New Jersey, what they did is on new cases, what they said was, in the case of Connecticut, 100% of those new cases had not been vaccinated. In the case of New Jersey, 99.5%. So if you've got the vaccination, I've had the vaccination, I had the virus in September, the vaccination in February. So I think all you can do is speak to the truth of the matter, use information and not use threats. And I don't know that we're doing a good job in any state. Those two states are doing a good job of selling that.
Thank you, and I know you're working hard to get the vaccines out with your employees. Let's continue to educate, and you're right, that's absolutely the key to it. Let's give our employees paid time off for the vaccines. We've got a question right here. If they want to go get the vaccine, give them paid time off, bring in people to educate them about the need for it, and if you can, if there's enough demand, bring in a clinic and have the access right there.
My name is Kim Walsh, and I work with the EOC Head Start. I have a teenager in high school and was just wondering, will the COVID vaccine be offered in the school systems the way that we offer the flu vaccine?
You want to answer that? We got Superintendent for Armorell. Come on.
We have enough need. If there is a need, we will absolutely bring an organization to get the vaccine. Absolutely, we'll do that.
Let me go ahead, Judge.
I've been prompted by Tamika Jenkins with our Industrial Development Foundation. She wanted to add that in talking about getting the vaccine out to the public, the Delta Population Health Institute has a mobile unit that's been to Mississippi County a number of times, and they will come back. They're able to be here, and they can set up at any church, any school that asks for that, and we can get the vaccine out in any area of the county.
We'll get it to you. Now, back on the schools for just a second. I think it's important for our school leadership to schedule clinics at your school. Schedule them. We'll help you to get that done. Because you look at if you're 12 and above, they can be vaccinated. Give them that opportunity. Give them that encouragement. And the teachers, there's a percent of the teachers that haven't been vaccinated yet. So let's try that. Let's see if we can improve that access. We've got to do some things here in Mississippi County that gets us up to about 50% before school started. We need to work harder to get that done here because we want to have a good year, and it's not going to be the best year if we don't improve that rate. Yes, ma'am. And we just got
Last question.
This might be our last question just because we're getting close to time. Yes, sir.
As someone who runs a lot of social media pages like the City of Blytheville and other pages, what is an example of a city in Arkansas who's doing great as far as this fully vaccinated rate? And are there some type of initiatives they're taking through social media that you could give us an example of that we could implement?
I don't have information on a social media campaign, but that's a good idea. And we do have, some counties and cities that have high vaccination rates. The cities have really, as you can see here, in every county, the cities are doing better. And I think what's happened is the pharmacists, the hospitals, the physicians have really promoted it. And so the incentive program has worked in terms of employers and what they have done. So there's some models out there, but let me look at that. That's a good suggestion. That would be a good best practice that maybe we can put out there that would be helpful. All right, you all are terrific. Johnny, a quick word.
Just a question for you, sir.
All right.
Governor, I just wonder if you and the doctor could maybe give us a little insight about FDA approval. How far are we away, gentlemen, from being at that point?
The question, if you didn't hear it, was FDA approval, and I asked that specifically to the White House and to the administrator of the Food and Drug Administration, the FDA, because I told them that's an obstacle if we can't get that approval. And the answer is we're working on it. And the data is in, they're reviewing the research, and everybody who looks at that research says it's clear. So I do expect that. Just my personal view is I think that we will get that approval before school starts. Dr. Romero, you want to bet against me?
I've learned not to, sir. But I've lost more bets to you than I. But it is coming. I expect it to be sometime in the very near future. As the governor has said, he actually has conferences with the White House, so he's in that track. He has more information than I do. But I expect it very closely. If I may make one comment about vaccinating kids, we will provide vaccine to schools as necessary. But I also want to encourage parents to have their children and their adolescents vaccinated now, before you get into school. Because once you're in that school environment, you're subject to being exposed to others. So I would like to see a larger number of our adolescents, the 12 through 18-year-olds, be vaccinated during these 4 weeks before we enter school. Because now is the time to give them the protection, not as they're walking through the threshold of the school door or while they're in classes. Let's get it done now.
Listen, you all have been really terrific, very respectful of each other. You've made great questions, and the benefit for me and Dr. Romero is that we've got a list of things we've got to follow up on. These are very, very good ideas that have come out of this, so we've got more work to do. I hope that you take from this, you've got more work to do as well, and this community really needs to engage in that. Sure.
Thank you. Yeah, the medical school in Jonesboro has been very helpful coming here and giving vaccinations. And if I can make a couple comments, one would be to the pastor. The pastors here are numerous. You have a lot of flock you're leading. The governor came here because of hesitancy, and I thank you. It is at the level where we're trusting, or we need the pastors and the people who don't have pastors. But pastors, you lead a lot of people, so you have to be on board to get people vaccinated, because this is where we are now. The variant has increased, and it's getting worse. And so if we don't do anything now, we're back where we were a year ago. And your comment earlier about history, I get some help with telling older people, people actually are maybe in their 60s, lift up your arm on your left side usually. See that scar from smallpox? You were vaccinated. We eradicated smallpox. You can still find it in Russia and CDC in Atlanta, but we eradicated it. So we don't die from smallpox. So the science is real, the disease is real, and then that usually, and some people that changes their mind. So thank you for letting me say something. Yeah.
That's a good message to end on. Listen, again, thank you. I want to thank the school for allowing us to use this beautiful arena, and for all of you giving part of this day for this very important mission. Thank you, and God bless you.